Good afternoon. I'm Dr. Bonnie Henry, Provincial Health Officer for British Columbia, and this is our COVID-19 update for Monday, October 19th. I'd like to start by acknowledging with gratitude that I'm here on the traditional territories of the Lekwungen-speaking people. I'm very grateful for the Esquimalt and the Songhees First Nations, the traditional keepers of this land, for allowing us to be and work and play and do our work in a good way on this land, and I'm especially appreciative today. So we're reporting on 3 periods today. From Friday to Saturday, we had 172 new cases diagnosed with COVID-19. Between Saturday and Sunday, we had an additional 153 new cases, and Sunday to today, an additional 174 more people were diagnosed with COVID-19. That's a total of 499 cases over the weekend, with 7 of those epidemiologically linked. That brings our total number of people diagnosed with COVID-19 in BC to 11,687. That includes 4,146 people in the Vancouver Coastal Health Authority, 6,244 in the Fraser Health Region, 243 people in the Vancouver Island Health Region, 611 people in the Interior Health Region, 355 people in the Northern Health Region, and 88 people who generally reside outside of Canada. That has gone down by 1 due to a data correction from Friday. We now have 1,639 active cases in the province, of whom 67 are in hospital, 19 of whom are in critical care or ICU. Sadly, we've had an additional 2 people who have died from COVID-19 over this past weekend, one of them in the Fraser Health Region and 1 person in the Vancouver Coastal Health Region. And we know how challenging it is to have a loved one pass away in these times, and how challenging it is for us to come together and mourn them. And our condolences go out to the families, to the care providers in both these cases, and to our communities who mourn their loss. We now have 4,028 people who are under public health monitoring, and 9,753 people who have recovered from COVID-19. We have 4 additional healthcare outbreaks that were found over the weekend, one at the Village in Langley, Rosemary Heights Seniors Village, the Zion Park Manor, and the Royal Arch Masonic Home. Unfortunately, a second occurrence of COVID-19 in that facility. And on a positive note, 2 of the recent outbreaks have been declared over. The Banfield Pavilion and the Yale Townhouse outbreaks are now both over. So that leaves us with 19 active outbreaks in our healthcare system, 17 in long-term care and assisted living, and 2 in acute care facilities, involving 932 people in long-term care, 536 residents, and 396 staff. We have 1 new community outbreak to report at J&L Beef Limited in the Fraser Health Region, and public health teams have been working with this facility, are on site and conducting contact tracing and making sure that the procedures are put in place to ensure workers are safe in that facility. And please, of course, continue to check the Health Authority and BC CDC websites for other smaller exposure events and for school exposure events. So there has been some questions that have arisen, not just here in BC, but across Canada and around the world, about a second wave. And one can say that we are in our second wave here of our COVID-19 storm in BC, but we have control over what that wave looks like, and we have shown that we can do that. There continues to be COVID-19 transmission in many parts of our province, and we know that this is expected. This virus has not gone away, and it has shown us that it is now quite able to hide and spread in our communities around the province. Encouragingly, we in BC are not seeing exponential growth. We do have more people in hospital than we did a few weeks ago, but that has also stabilized. What we are seeing is continued ongoing growth and particular focus are hotspots, particularly where we have our largest population in the Lower Mainland. We need, however, to make sure that we are doing what we can to avoid a steep and sudden increase in new cases that we have seen in other parts of Canada, in our neighboring countries, and around the world. We know that this can happen, and when it does, it can overwhelm our healthcare system. And that is difficult not just for our frontline healthcare workers. It means it's more challenging to care for anyone who's ill, whether from COVID-19 or another illness. It makes it more difficult as well to keep those important things in our community going, like our surgery restarts and other services. Small sacrifices that each of us can make now will help us, help our community, and help control and support of our community to keep our priorities going. Our priorities like our surgical restart, like making sure our children are getting the educational and social and emotional supports they need in classrooms, like our businesses that are keeping people employed and keeping our communities well. It makes us very difficult to address the other critical health issues we have in BC, including our overdose emergency, if we have concerns with rapidly spreading growth of this virus. We know that these consequences of COVID-19 are far-reaching because the impact it has had on so many people in so many aspects of our society. This is why it is critically important we all remain vigilant so that we can continue, as we have been doing, to slow the spread as much as possible. We want and need to keep everybody safe and as many activities as possible open for all of us. This is the balance we are working to achieve. We have done it before, and we can do it again, finding that balance. And the way we do it is by each of us doing individual measures, like taking the precautions and using our layers of protection wherever we may be. Many of the new cases in these past few days are connected to new clusters and outbreaks, many of them small, but some larger, especially associated with our essential services, places like grocery stores, places like food processing plants, where we know there can be a challenge in managing. Our contact tracing teams are working around the clock to track every new case that emerges, and they are good at what they do. And we in public health have been working together to track every single case in this province, and we've been successful at supporting our communities and making sure we can find that balance of keeping our cases low. If you are contacted by public health, that may be because you've been exposed to this virus, and there's a possibility you might get ill yourself. Public health is there to support you, to make sure that you can isolate and get tested if you need to. As well, by sharing information, if you are sick, about where you've been and who you've been with, will ensure that we can make sure that one case doesn't turn into 100. And by keeping our groups low and keeping our distances, wearing our masks when it's important, we can keep our transmission risks low in our community as well. Everyone in BC has a role to play, and we know that most people are doing this. We are making a difference in our own communities, in our own families. What we do personally helps everyone around us, and it also helps our public health teams, helps our healthcare workers who are busily in our facilities with our surgical restarts. It helps all of our essential workers, from food plants to grocery stores, to the critical workers we have in our schools, our educators and staff. I know some things are easier to do than others. Cleaning your hands, wearing a mask, maintaining a safe physical distance is something all of us can do and are doing. Not seeing family and loved ones is much harder. It requires more effort and more sacrifice. But I want you to know that what you are doing is making a difference. It makes a difference for you, your family, your loved ones, for colleagues and friends, for those we know and those we don't know. Let's keep doing what we're doing, keeping our COVID-19 pandemic low and slow so that we can manage, so that we can continue to have the essential priorities open in our communities, in keeping our communities well. Please continue to do your part today and every day. And as I say, please continue to be kind, to be calm, and be safe. And I'm going to add to that today, to be brave, that we can get through this together and we can support each other. Thank you. And I'm happy to take questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. Please also take your phones off mute. You will not be audible until your name is called. First question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry. Thanks for taking my question. I guess first up, regarding the second wave that we're now in, today across the country, we saw case counts top 200,000, and my calculation is that BC is still less than 6% of the total across the country. So what more can we be doing to try to keep this virus from spiraling out of control in this province when we're seeing now a record number of daily cases in this province just yesterday?
Yeah, you know, I think what we're seeing and the fact that we are underrepresented in what's been happening nationally is a testament to the fact that people in BC are doing the right thing. The vast majority of people have taken this to heart. We're making sure that our communities can still function, that kids can still go safely to school. And what we're seeing are exposures that are related to this ongoing transmission. So keeping up our vigilance is really important, making sure we get tested when we need to, taking all of those measures that we have been doing, and not losing heart. As you can see, we are still able to manage it here. We're doing well. Our public health teams are supporting everybody who's been exposed, everybody who's been tested positive, to make sure that we can keep a lid on it and not let things grow. But we all have to continue to do our part. You know, businesses need to follow their COVID safety plans, whether it's a small business or a retail outlet or a restaurant. When we follow those plans, we know that we can make a difference and we can stop the spread. We need all of us to consider our community, and we talked about this before Thanksgiving, being grateful, but being grateful in a way that protects those who are most at risk, particularly our seniors and elders. And we need to continue doing that, and we've shown that we can do that, and we're going to weather this storm together.
Do you have a follow-up, Marcella?
I do. It's regarding all the speculation that we're hearing on social media. I'm getting emails from people, but just asking you to respond to all the speculation out there from frustrated parents and others who seem to be suggesting that there's a deliberate lack of clarity when it comes to keeping this virus out of BC schools, and whether or not we're asking teachers and other school employees who might be sick to still go to work because you're worried about possible staffing shortages.
Yeah, well, I can say that that's not the plan. No, there's no conspiracy. And I think we all need to be patient and to recognize that there are ways that we do things to make sure that people aren't inadvertently exposed as somebody who might be carrying COVID-19 or might be infected. And there's a very good reason for that. And it's about finding a balance. And every single exposure event is being posted. And those people who have had contact are being contacted by public health, and I am confident, and I have heard repeatedly from families who've been involved, that they are getting the support they need from public health, and I think we need to continue doing that, continuing to be patient with each other, and to not feed on rumors that we may or may not know to be true. And sometimes it's very challenging because we are all worried. I know parents are worried, and sometimes that anxiety spreads to our children too, and our kids are a little concerned. We're worried about what may happen, and we know now, we've been through this for now almost 2 months, and we know that sometimes there are exposures in schools, but we have not seen widespread outbreaks. We've seen very limited transmission, and that tells us that things are working in our schools. Things are being followed, things are being managed, we have good connections with public health, and that we're making it through this, and we need to keep doing that and keep making it through this for the sake of our communities and our children in the next coming months. And it may be challenging some days, particularly as we see more influenza season, more influenza illness come by. And we know that we don't want people in schools with influenza either. So yes, we need to keep monitoring this, and we will be there in public health to support schools.
Next question is from Rob Brown, Dawson Creek Mirror.
Good afternoon. How are you? Hello?
Okay, we'll come back to Rob. Next question is from Tanya Fletcher, CBC.
Well, hi, Dr. Henry. You referenced the overdose crisis off the top, and I want to ask about Surrey RCMP. They responded to 5 people overdosing in one place over the weekend, and they say they want public health and the public to understand that overdoses are happening increasingly in the suburbs and that more resources need to be placed there instead of just safe consumption sites, say in downtown Vancouver. So can you speak to that and what efforts are being made or other efforts being discussed to address this problem?
Sure, and yes, we are well aware that our overdose crisis is concentrated in many places in this province, and certainly the data we reported on last month shows that there has been a dramatic increase in the toxicity of the street drug supply, and I'm aware over this weekend we had a large number of overdoses related to people who were taking stimulants like cocaine that had been adulterated and contaminated. So this is something that is important across the province, and we do have teams in every health authority that are working in communities to support people who use drugs, to make sure that they know they can reach out. And this is another opportunity to remind people that most of our overdose deaths are now happening in people at home, and their families may not know that they are using drugs, and people are afraid to talk about it because of the stigma that's associated and the shame that's associated with drug use. Now is an important time to have those conversations with the people that you love, to make sure they know that there is support out there and that there is a place to go and that we can talk about this.
Tanya, do you have a follow-up?
Yes, please. Thank you. We've spoken to recovery centers in Metro Vancouver and are wondering why, maybe aside from COVID-19, we're now looking at 6 to 8 week wait times to get into some when they used to say it used to take just like 1 to 2 days.
I'm afraid I can't respond to that specific question. I'm not aware of why or if there's a change in wait times for that specific area. I do know that the work that we've been doing to support people in recovery, to support people who are using drugs in accessing safe supply, in making sure that we can support people when they're at that place where recovery is an option, and that is ongoing despite the pandemic.
Next question is from Lisa Cordasco, CHLY.
Thank you. Thank you for taking my question, Dr. Henry. According to WorkSafe BC, only municipal police forces in British Columbia are required to create COVID-19 safety plans, and that WorkSafe BC does not enforce any COVID issues in relation to the RCMP, as it is a federally regulated agency. Does that concern you?
No, there's a number of federal agencies that work within the province, CBSA, the RCMP, and there is an occupational health and safety program for federal agencies that we have connected with, and we're ensuring that what they have in place for federal agencies works as well for those agencies here in BC. So we do have an ongoing relationship with the people who work in the occupational health and safety program for the federal services here in BC.
Lisa, do you have a follow-up?
Yes, thank you. So are you saying that you, as the provincial health officer, do you have any say in these plans, or do you have a chance to look at them and approve them, and that's kind of the way they sit because they can't be enforced by WorkSafe?
Yeah, so it depends on the situation, but yes, I have been in touch with, for example, the RCMP, with my colleagues who work in the regional office for the Public Health Agency, for Health Canada, and for the occupational support team at Health Canada out here, and we are ensuring that things are aligned and that the supports they need are there as well. And any positive case in a federal population, the other group that we work very closely with are the federal correctional facilities. facilities, for example. So those are all, anybody who develops COVID is reported to public health. The testing is all done through our team, and we support them in being able to isolate, get the treatment they need, etc. So there's an ongoing relationship that we have with all of the federal populations here in British Columbia.
Alex McKean, Toronto Star.
Hi, Dr. Henry. I wanted to ask about when we're looking at the proportion of cases that are explained or linked to clusters here in British Columbia. That's something that we hear you reporting on quite a lot, and we know that that it's a pretty high proportion here in British Columbia that we're able to trace back to a cluster, even if it's a new cluster, as we heard about today. I'm wondering if you can help explain to us and to readers the degree to which that number, that ratio that is, connected to, of cases that are connected to clusters, the degree to which that number is related to the level of restrictions that we have in place here in British Columbia, the fact that we still have many businesses that are open compared to hotspots that we see in Ontario and in Quebec, or whether there are other factors that are really significant in determining the level of restrictions here, more significant than that one that I just described.
Yeah, so I've said this many times over the last few months. The unlinked cases are the ones that cause us most concern. And we know from this virus, we've learned a lot over the last 10 months. We know that most people transmit to none or one person. Some people will transmit to a large number of people. So, and we don't always know why. Those super spreader events sometimes, or they're what we call random events or stochastic events in some places. But we know there are conditions that make those types of spreading more likely. And those conditions are, we've heard them referred to as the 4 C's. So in a closed environment where close contact with crowds, large numbers of people, where there's poor ventilation, and we've seen that. We've seen that in workplaces, we've seen that in nightclubs, for example, where we had spread between larger numbers of people, and it made our work in contact tracing very difficult because you didn't always know those people. And we would find that it was a challenge to understand exactly who was in that nightclub at that period of time and who you might have come in contact with, and then to connect with them. So it makes our job in contact tracing much more difficult compared to a restaurant where you might have a small number of people. We put the limit at 6 at a table where you have a contact number, so the risk is much more controlled and managed. So what we have tried to do in British Columbia and been successful at, because people have taken this to heart, is only put in PHO orders to try and reduce those areas where we know these things are happening, where we know transmission has been happening. So we've put in very few orders, some around times for restaurants, because what was happening was we were seeing that late at night people were going there to drink, and it became more like that nightclub environment. We've had to put some orders around banquet halls because we knew that it was very challenging, and we were seeing very challenging for them to manage the 50-person limit, and families wanted to be together or wanted to have celebrations with larger numbers of people, and that was leading to transmission to large numbers of people. So our focus has always been on trying to reduce those environments where it's more likely that somebody is going to spread to larger numbers of people. And that's why we've consistently stayed at 50 for any gathering, plus with the provisions that particularly if you're inside, you need to have sufficient space between people that you're not going to put them at risk. And we need to use our other measures like hand cleaning and wearing masks. So what we have seen is that when those provisions are in place, we don't see transmission of this virus to large numbers of people, and that has meant we've not had to close down additional businesses and other things. Other provinces have taken different measures. And we're all trying to muddle through this together, learning as much as we can from what we see around the world. So we have tried to minimize and take restrictions, and we've put in another order that requires every business to have a plan. And I think that is an important way of us reinforcing that every single business needs to look at their individual situation. And the guidance that we've put out through the BC CDC and WorkSafe BC helps every different sector. And as I've said many times, I don't know the ins and outs of every single sector. So if we have, we've connected with every different part of industries to be able to put those things together. And that has been successful for us. If we think about this past summer, we planted over 300 million trees in the north in BC. And those are incredibly important to our climate and our ecosystem. And we did it with thousands of workers going up into the remote areas and not a single case of COVID. So we know, for example, when we have temporary farm workers and we support them to isolate for 14 days, we're not getting outbreaks on farms. So this is the approach that we will continue to take as we're moving into this respiratory season, finding the balance and making sure that we take action if we need to try and reduce areas where we're seeing transmission happening.
Alex, do you have a follow-up?
Yes, just a quick one. That's really helpful. Thank you, Dr. Henry. So when you're describing how most people who are infected with COVID-19, they're transmitting to either nobody else or one person, the new cases that we're seeing in BC, are a lot of them those, one close contacts who are connected to somebody who is already sick, or are more of the cases connected to those rarer super spreader, whatever the correct name would be for those events where more people are getting it at one time?
Yeah, it is a combination, but we are mostly seeing small transmission chains within a family, within a group, and because we're not allowing those groups to be very large, the transmission stops, or it only spreads to a few people. We are seeing many small clusters, and then we have a number of larger clusters, primarily like one we saw today in a number of workplaces, essential workplaces, where people are in close contact, and there may be breaches in the protective barriers that we have in place. So it is a combination. We were seeing quite a lot more large spreader events when we had nightclubs open, when there were large parties through the summer, but mostly those have settled down or become much smaller and more easy for us to contain. When we find people, we can isolate people before they develop symptoms, before they spread on to that next group of people. And that's how we have been pretty successful about breaking the chains in our community. And we need to keep up with that, because it's when you start getting a lot of spread in the community that you can't keep up with the contact tracing, with the numbers of chains of transmission, that you have to refocus and shut down, take more blunt instruments in trying to prevent occasions for spread to happen. And we're seeing that in some other countries and some other jurisdictions. I will say the one other factor that's in there in terms of biology is that some people seem to spread more virus than others. And we can't tell ahead of time who it is or why some people seem to be more able to spread the virus than others.
Next question is from Keith Baldry, Global News.
Hi, Dr. Henry. Thanks for this. Just on the flu vaccine, pharmacists are reporting they're having a difficult time securing doses of Fluzone, the high-dose flu vaccine for seniors. They say 45,000 doses secured by the province have been entirely allocated to seniors in long-term care and assisted living, but they're getting a huge demand from seniors not in long-term care for this vaccine. Is there any thought of getting more of that vaccine or redistributing it?
So the high-dose vaccine has been supported by the federal government, and we bought up as much as we possibly could to cover all of our most at-risk seniors in long-term care homes and in assisted living. So there is not more to be bought in the public system. I understand there is still some available in the private system that pharmacies can access, but the priority really was to protect those who are in those settings where this virus where influenza can spread more quickly. So that is our public program. I will say that the other vaccines that we have are effective and safe and work for seniors in the community as well. And if their high-dose vaccine is not available, then they absolutely should receive the vaccine that is available at all pharmacies. We now have the public health clinics starting. More vaccine is coming in by the day, and we have the next few weeks to get everybody immunized here in the province.
Do you have another question, Keith?
Yes, thank you. Just at the overall COVID-19 numbers this month, I noticed about 60% are in Fraser Health, which is, I guess, fits the fact that they're the most popular health authority. But within that group, about 80% are in Fraser South, which seems to be mostly Surrey. Is there concern about, is there something going on in Surrey? Are there gatherings or family gatherings or activities occurring there that aren't happening elsewhere and leading to quite a big surge in numbers there?
There is, and yes, we are, the areas of the lower mainland, as I've said, but particularly Fraser South. There's a number of different reasons. Some of it is spread within large family groups inadvertently, but it's also, there's a large number of essential workers. So many of our poultry producing plants, the fruit producing plants, the large congregate living settings for farm workers, many healthcare workers and others, truckers, other essential services are people who live or work in those areas. So that has a huge part of it as well.
Next question is from Shannon Patterson, CTV.
Hi, Dr. Henry. Ontario's provincial health officer is now asking parents in their 4 hardest hit regions, and that includes Toronto and Ottawa, not to send their kids trick-or-treating. What do you think of that decision from your colleague in Ontario? And if cases continue to grow here leading up to Halloween, could you envision making that same recommendation in the really hard-hit regions here, like Keith was just talking about in Fraser South?
I'm not going to comment. We are, as I've said all along, we're all experiencing our own pandemic. And here in BC, we've managed to relatively control our community spread. And really, when we think about the trick-or-treating, it's outside, it's a relatively low-risk environment, and there are many innovative things that I've been hearing from my friends and from parents around the province about things that we can do to do that safely. I think it's important for us to remember that ceremonies are things that children remember as well, and that this one will be different, and it needs to be small, we need to have distancing, and we need to really, really respect that some people don't want to play this year, and they don't want to have people coming to their house. And I think that is something that's important. And I would encourage parents across the province to look at having small gatherings in your home, making sure you connect with people in your community about who does want to have children come to their house, and do it in a very small way, in a limited way, and do some of the other innovative things. One of my parent friends was talking about either a tube or having a little line with clips that they can put little packages down to children at a distance. So I think there's lots of things that we can do to make it safe and keep it outside and keep it small.
Shannon, do you have a follow-up?
Yeah, Ontario's provincial health officer's worries are that kids reaching into candy bowls, comparing and sharing treats as they often do while trick-or-treating is simply too dangerous. Do you not agree with him? And if not, can you describe a safe way that would work for both the people, the parents handing out candy at front doors, and also for the kids who are the ones doing the trick-or-treating? How would it work safely if you don't agree with the Ontario provincial health officer's concerns that it's just too unsafe?
I haven't heard what they've been talking about, but what we know is that this virus is spread between people when they're in close contact through respiratory droplets. And so as long as children are washing their hands, we have single packaged candies, so this is not the time to do the homemade candy apples, but to have things that are prepackaged that children can receive in individual packets so they're not digging into a common bowl, and maintaining distances. And as I say, there's lots of innovative ways to do that. But this is not the year where we're going to have hundreds of kids going to hundreds of houses in large groups. That can't happen this year. This has to be, Halloween in the time of a pandemic. And for many families, that'll mean staying at home and maybe having a candy hunt in the house and watching a scary movie. And that's fine. That's okay too.
Kevin Forsyth, Oceanside News.
Hi, Dr. Henry. We've been hearing from local pub owners who are frustrated with having to close for an hour of cleaning after a live performance. With what we know about how COVID-19 is being spread, and that seems to be from being in close contact with an infected person, is it necessary to put this emphasis on all the extra surface cleaning, considering the stress it is causing some business owners?
Well, if we think about those situations where we know that this virus can be spread, we're talking about enclosed spaces with poor ventilation where there's large numbers of people in close contact. And what we need to do is make sure there's adequate time. In those situations, we know that environments can make a difference. So we want to have adequate time for cleaning, but also for air exchanges within the building. So these are all important things that minimize risk so that we can keep the business open.
Kevin, do you have a follow-up?
No follow-up, thank you.
Thank you. Next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. Thanks for taking my question. In the past, you've referred to increases in COVID-19 cases as surges rather than a wave. What are the factors of how the virus is progressing in BC right now that leads you to determine that we're in a second wave of the pandemic here?
Yeah, I've called it a mogul, I think, before too. What I'm reflecting is the fact that what we're seeing around the world really is a surge again. So I'm not sure if a surge, a second surge, but the reality is that we are seeing increased numbers of cases. We've also seen increased hospitalizations. They've leveled off. What we are not seeing is rapidly increased, logarithmic increase in numbers of cases and a surge in our hospital system. But if we remember the models that we showed, there is still a possibility of that. So we cannot let up. When we know that what's happening all around us, we know that we have to maintain this balance. We have to maintain our contact tracing. We have to keep our numbers small because it is possible that we could go into one of those rapidly increasing curves or waves as well. So it is important for us to recognize that we are in a tricky place right now. We're in a place where we are seeing increased numbers of cases, mostly in younger people, mostly not needing hospitalization, but some people do. And we still know there's vulnerabilities in our long-term care homes, and we know that we're going into respiratory season and influenza season. So right now, we're holding our own, but we need to be cautious and we need to maintain those little sacrifices that each and every one of us is doing every day to keep our community well and going.
Do you have a follow-up, Brishti?
Yes. Given that we're in the second wave right now, and we're also seeing a lot of people holding increasingly anti-mask views and talking about how COVID-19 is a hoax, what do you think you can say now to those people to maybe reassure them and try to make people take masks more seriously?
Yeah, I'm not sure that I can reassure a small group of people, and I would emphasize that. Though they might be quite visible, we know that the vast majority of people in BC are doing the right thing, and they've done that continuously from the beginning. And yes, we're all tired, but we know we can get through this, and we've shown incredible adaptability and resilience, and that's important. And a small number of people, sometimes when there's challenges that you don't understand, some people's reaction is to go along with the conspiracy theories that are out there. And we know this happens with anti-vaccine activists, and I think they're taking a lot of the strategies that some of the anti-vaccine activists have been using and applying those to masks. And I know a lot of it reflects some of the political rhetoric, unfortunately, from our neighbors to the south. But we do know here that if we have this virus is in our community, and we have the means and we have the knowledge and we know how we can manage it and live with it and keep our communities together, keep our schools open, keep as many of our businesses as possible open. So I would just appeal to everybody in BC to continue doing the right thing and to remember what we've been talking about all along, that we don't always know where another person is coming from, and we need to remain calm. We need to accept that they may have a view that we don't agree with, and we need to, step away from the conflict.
Next question is from Rob Brown, Dawson Creek Mirror.
Thanks for taking my question, Dr. Henry. Just as it relates to enforcement, be it in public or now that schools are back, every time parents pop by the schools, they note that every parent and every adult seems to be social distancing, but there seems to be very little going on with the children in the schools. Not that we're enforcing this on the schools or on children, but how does that work as far as again educating through the government down to the teachers, through the education, and then to parents and children as well? Are there steps that can be taken? Because every time the bell rings for pickup, it's the same song and dance at certainly every school here in the north.
Well, I've actually seen many great examples of how it's being managed in schools around the province. Haven't been up to the north recently. I was trying not to fly too much. But I do know that not only are kids resilient and adaptable and learning, but they bring that home to their parents in many cases too. And I just want to salute the teachers and the staff, the educators around the province, because they are working it out in schools. And we're seeing that. We're seeing small exposure events occasionally when people, usually as part of a family cluster, or somebody's exposed at work, somebody comes into a school, but we're not seeing a lot of transmission. So children are paying attention, and I think it's a testament to the work that the schools are doing and that the teachers are doing across the province, that it is keeping our classes open, keeping children learning in an important environment.
Rob, do you have a follow-up?
Certainly. Just as it relates to a specific family up here, obviously not getting into the identity of the family or anything like that, but we had a family that was awaiting an elementary student pending a test. Meanwhile, their older sibling was told they didn't have to isolate, and then, obviously, to me, that would render the test, but also the results of where contact tracing it could be traced to almost irrelevant if you've got, one sibling in the house having to isolate because they're waiting for a test result. Meanwhile, older sibling can come and go as it pleases, or as they please. Is that something that is flat out just a mistake, or is that something that, again, they're following the protocol? And if that's the protocol, that's good enough for the family if it's good enough for the province.
Yeah, so everything, it depends. Nothing is black and white when we're talking about this. So it would depend on the circumstances around one of the children. If they would just had a mild symptoms that weren't associated with an exposure to COVID, then it may not be required. In most cases, it would not be required for the rest of the family to self-isolate. They would want to ensure that the child who is ill stays away as much as possible from the others, but as long as everybody else is feeling well and have not had an exposure to somebody with COVID-19 themselves, then they would not necessarily need to isolate.
We have time for one more question this afternoon. For everyone listening, Dr. Henry will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. And for information about the province's pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Jane Side, North Shore News.
Hi, Dr. Henry. My question is, I have heard that there have been a number of kitchen workers who work at Lionsgate Hospital for the contractor there who have been testing positive for COVID-19. And I'm wondering if there's any concern there about how this is being transmitted and whether workers are transmitting that to each other in that environment, given the sorts of protocols that are in place.
So anybody who works in a healthcare facility is considered a healthcare worker in our broad definition. So these people who work in the kitchen at Lionsgate Hospital or any other facility would be included with the ongoing surveillance that we're doing in healthcare workers across the province. And I know that Vancouver Coastal works very closely with the infection control program at Lionsgate, so they would be managing any concerning exposures.
Jane, do you have another question?
Yeah, I'm just wondering, I don't have a lot of information about this, but if they are considered healthcare workers, I don't see that on any of the current outbreaks list. Would they be considered an outbreak or an outbreak among healthcare workers?
If any healthcare worker in any facility who tests positive, who has an exposure within the facility, would be managed by Vancouver Coastal Health. And outbreaks are reported as a single healthcare worker who was at work during an exposure period.
That's all the time we have for today. Thank you, everyone, for joining us.
Thank you.